Dr. Ralph Clayman is here now talking about innovation in urology. Thank you so much for joining me. So when it comes to innovation in urology, why is it important to take it from a seminal why to a functional how?
Why is the question. So the why is you're looking at something and going, well, why is it this way? Why are we still doing that? Um, why did this happen to my patient? And so that's a question that's going to stimulate basically your creative thought. The action part then is, well, how do we change this? How do we make things better? How do we alter the status quo? How do we prevent this from happening in another patient? So why is the creative impetus? How is the action item?
So what does that look like for professionals in urologic care?
I think that urology is a very unique specialty. I think as a group, urologists are incredibly creative, inventive, curious, and out of that has come just a host of things over the years. In my own situation, we've seen endourology, laparoscopy, robotics all come into urology. It was the creativity of the urologist who saw the benefit in robotic surgery. If you look at the history, at least in the United States, it was money men going, hey, laparoscopic surgery is just a little bit too difficult for doing prostates, and he was right. Let's look at the robot, and it changed everything. As the founder of Intuitive would tell you, from their standpoint, they looked at their robot as something for cardiac surgery. And what he is very glib about saying, but also very happy about saying, is we aim for the heart, we hit the prostate. But speaks to the creativity and the imagination of the urologic surgeon and the willingness to change. The idea that no matter what we're doing today, it probably is not as good as what we could be doing tomorrow for our patients. Let's go down that road.
And what are you hoping attendees take away from your lecture?
Once you know your create skills and your innovative personality, then you have the ability to go out and identify other people who don't duplicate those skills and personalities, but who actually complement them. So then you wind up with a complete team of individuals who cover all the bases of creativity, all the bases of innovative personalities. And with that team, you are then able to go ahead and make a change if that change is worth making. So the innovation requires there to be an urgency. Why are you doing this? What is the purpose of this? And then you need to know, do I have the environment in which to do it? Do I have a laboratory? Do I have the time to do this? Do I have some people outside of urology who are willing to help back me in this?
Dr. Clayman, thank you so much for joining me.
Well, thank you so much. It's been a pleasure speaking with you.